Hey everyone, welcome to Taking the Pulse, a healthcare and life sciences video podcast. I am Heather Hoops Matthews, here today with Maynard Nexon healthcare attorney Lauren DeMoss, and we are coming to you live from NCLifeSci, one of the Southeast's premier life sciences events, pulling together both regional and national life sciences industry leaders. Joining us to talk AI in healthcare is Dr. Justin Collier. Dr. Collier is a physician who is now spearheading healthcare technology innovation in North America for one of the world's largest technology leaders in the world, Lenovo. Dr. Collier, thank you for joining us today.
Yeah, thanks for having me. This is exciting.
Now, we know Lenovo is celebrating 20 years of having one of two global headquarters in North America, actually right here in the Triangle area of Raleigh.
Absolutely.
And you personally have more than 2 decades of experience in healthcare IT. Before we get to the hot topic of AI, would you please share with us how you got to your current position after medical school and residency?
Oh, sure. Gosh, it's a long story. I'll give you the short version.
Okay.
So when I went from residency into practice, I moved to a hospital that didn't have electronic health records. And I had those great experiences with electronic health records. Actually went through the transition from paper to electronic when I was a medical student, and then moved to a residency that had their own electronic health record, had worked with the IT team pretty extensively, making that even better, selfishly for myself and my colleagues. And then went to a hospital that didn't have electronic health records. They were still on paper. Needless to say, I recognized all of the safety nets and the other aspects of electronic health records that just weren't there for me. So I complained a lot. And as things sometimes happen, the health system headquarters was not too far from the hospital where I was practicing. They said, hey, we're gonna pilot this, and we'll pilot it at your hospital, but since you complain a lot, you can help lead that effort. Thankfully, that went well.
Yes.
And they said, hey, we need more of your time. What do you think about doing this part-time? We're going to do some more implementations in other hospitals. And I said, sure, that's a great way to have a bigger impact than I can have just one patient at a time at the bedside. And that lasted for about 5 months. And they said, hey, we need 100% of your time.
Right.
And by the way, you can work on things that are not just electronic health records. We'll sweeten the deal. We'll let you work on analytics. We'll let you work on business intelligence. We'll let you work on telemedicine. We haven't done that yet either. So I got to get involved in all kinds of fun tech projects, really help a health system, not only for the division where I was working, but for the division as a whole, or for the organization as a whole. And did that for about 7.5 years. It was pretty exciting. Then I moved to a global system integrator, worked helping lead their healthcare and life sciences efforts for about 6 years, and now I've come to Lenovo.
Yes, well, they're fortunate to have you.
Yes.
I feel like I'm the fortunate one.
Yes. Yeah. Dr. Collier, thinking about everything you've been involved in, and fast forward to now, AI is obviously the cutting edge thing now, and we're seeing it pop up in so many different ways in the healthcare context. Can you talk to us about, kind of in your view, the most successful AI you see being employed and how that helps patients and providers?
Oh, this could be a really long conversation, but I'll try to keep it
a few examples.
So the neat thing is AI has been around for a long time, as we know. It's gotten very buzzy, I would say, and very popular just because it's been democratized recently. So people see ChatGPT, they can interact with it, they see Copilot, they see Gemini, they see all these tools that are suddenly available to the public, and they're easy to use. And so now people are realizing, hey, there's a lot of benefit there. There's a lot we can do with these tools. What else can we do? And so people are really finally getting on board with doing more and more of that. Healthcare has had AI in some small places and small pockets in a variety of different settings for quite a while. Where we see it taking off most, actually, there are two arenas. In the medical imaging space, radiologists, of course, were very early to try to digitize and electronify, if that's a word. So they moved from the old films on the light board that you still see in some TV shows to having digital imaging. So they've been very tech forward as a specialty for a long time. They were one of the first clinically to adopt AI to aid them in their work, helping with diagnoses, helping with triage of images, knowing which patients to look at first, those types of things. And there's a lot of really great things happening in that space. So from a clinical lens, that's one of the leaders. We'll see that as well with digital pathology as the U.S. and other countries move in that direction. Most of digital pathology, of course, today is still glass slides with a microscope and somebody looking through the microscope. We'll see that digitization probably play out over the next 3 to 5 years. And then there will be tons of tools, because it's medical imaging. A lot of the same technologies can be applied to find those patterns in those types of images. Really excited to see that, because we have a massive shortage of pathologists that we can't possibly train our way out of. On the other hand, there are all the administrative burdening tasks, the things that are not value-added work, but are very repetitive, very administrative. We're seeing a lot of advancements there. Even things just as simple as ambient listening for writing documentation. Huge benefit to the physicians, making a big difference. I would say that's a great area that's getting pretty broad adoption. But there are also those back office things. How do you appeal denials, claims denials? How do you do prior authorizations in an automated way? Things where it takes away from humans doing things only humans can do.
Sure.
Because it's just repetitive administrative tasks.
Sure. That makes sense, with a second set of ears listening.
Sure.
Now, along with the opportunities, there are also challenges with AI.
Always.
We've talked about them, regulatory, ethical issues. What do you see as maybe a couple of the top challenges, and how are you and Lenovo team addressing those?
Can I maybe have three?
Sure, you can have three.
So one is governance. And I think
Okay.
that every organization really needs to have a very strong governance structure. They should for all technologies. But AI is an area where that's really, really important because it involves so much data, because it involves so many questions, and because it involves, in a lot of cases, things that are not developed at the organization that's using it, right? You have a lot of vendor solutions and other things. All that needs to be really looked at. And then, of course, there's not an unlimited budget at any organization. You need to be able to prioritize which things you're going to do with the technology money that you have, and make sure that you're focusing on the right things. So getting great governance stood up, making sure that it's truly multidisciplinary, and multidisciplinary probably more than anything else the hospital has ever done. It needs to include all of the different stakeholders, and I would argue including the patients, right? So having patient advisory members that are part of that AI governance in the forefront, not as an afterthought, but from the very beginning all the way through the process is really important, as well as clinicians of all types. But really all areas of the hospital have to be engaged and involved to do it well, to do it right, to make sure that they're doing it in a responsible way, watching for things like bias, watching for things like ethical concerns, watching for privacy, security, all the other concerns involved. So cybersecurity, of course, very big, hot topic right now. Governance is number one. Number two is education, because there are tons and tons of people that don't really understand what is AI, how is it going to impact my work, what's involved, what is this AI going to do, how is that going to play out. Just that education, and it's got to be a broad education again. Everybody from the board level down throughout the entire healthcare organization really should have that basic foundational knowledge of what is AI and how are we as an organization using it. Super important. And then the third thing is making sure that it's incorporated in a workflow. Now that may mean that the workflow needs to be redesigned, but it has to be incorporated in the workflow, not a distraction from the workflow. Otherwise it becomes a burden, right? And the whole goal is to eliminate burdens,
Correct,
right? The whole goal is to make this a better process that really helps people, either to do their job better or to take better care of patients, or helps the patients themselves to get answers that they need.
That sounds like a lot of planning and not just jumping into something.
100%.
Yeah.
100%.
Yeah, I agree with you on the governance piece, because we have clients, large health systems in different pockets, different departments have products that are geared towards them, whether it be clinically or on the administrative side. And so they're getting these products, but there needs to be a central flow so that everyone knows what's being used, they can vet it appropriately,
And potentially use tools in multiple domains.
Correct.
Right? If you're allowing it to be purchased just wherever willy-nilly, then you don't necessarily even have a great understanding of what's in your environment,
Right.
Which has always been a big problem with sort of shadow IT and technology hidden in silos. The organization doesn't gain the most benefit from it, and you also can't use those tools in concert. You can't use tools together to to do even more if you don't even know that they're there.
Right. And you need to know they're there for cybersecurity and privacy concerns,
100%.
which you touched on, and that's obviously a huge
Sure.
area that is somewhat regulated, unlike maybe some of the other AI tools that states are looking to figure out how to regulate. But on the cybersecurity and privacy side, what are kind of your recommendations there?
Sure. So I would say there are a couple of different recommendations. One is be sure that you understand all of the technology tools that are coming into your environment. A lot of them over the next 3 years will have AI in them, whether you want it or not, whether they even advertise it or not. You really almost need a nutritional label on vendor products these days to understand which things have AI tools embedded in them. What are those AI tools? How are they being updated? Which foundational models? There's only a handful of true foundational models in the world, regardless of industry. So which one is this vendor using when they come and tell you their product has AI? Mm-hmm. Well, number one, is it even really AI? But if they do tell you it's AI, what is the foundational model? How are they updating it? What are the risks of bias? What are those things? Like, you have to be able to understand that. It's super important. It's super hard.
It is.
But it's something that if you don't do it on the front end, your organization is going to run into trouble at some point when you're accidentally using an AI tool that sends information somewhere you didn't know, and then you have those privacy concerns. Nobody wants a visit from OCR.
No.
None of those things are good. And they're not in the best interest of the organization to be blind to what's really going on in their environment. The second big thing around cybersecurity is, again, education. Make sure that everybody in the organization is getting that cybersecurity education alongside the AI education, and really thinking through that. In terms of organizations, since we're at a life sciences conference, or organizations that do a lot of research, make sure that you have governance around who gets access to which data sets for the projects they're doing, that even if they're being run on premises with AI tools, make sure that you're limiting the data to what they really need. Mm-hmm. Right. I think that's just wise.
Yeah. You'll need Lauren.
Well, and that's, there are so many issues. Obviously, my mind goes contractually to folks not understanding what kind of rights they're giving to their data. Are
Sure.
you helping train the model? You may be using it, but you're also likely helping train it and giving away data rights. On
every agreement to receive treatment, there needs to be some discussion about how your data is going to be used. Mm-hmm. There probably is, but it may need to be updated for the AI era.
Yes.
I can tell your background as a practicing physician must really help you as you explain these processes to healthcare providers.
Tremendously.
If somebody hasn't started or has started and hasn't maybe started well, what would you suggest to them as maybe step 1, 2?
So where to start? We already talked about governance being step 1.
Yes.
But how to pick a project, how to pick what things you're going to do with AI. I really like to tell organizations they need to focus on what I call the Goldilocks zone, right? So it's the R's of AI, if you will. So you want to have low risk.
Okay.
So that's R1.
Okay.
Rapidity to deploy. That's R2.
Okay.
And then a measurable result. Doesn't always have to be return on investment in a dollar standpoint, but it has to be a result that really matters to the organization that you can drive, right? Efficiency of clinicians, for example, would be a great result. You don't need them necessarily to be more productive. They're already working so hard that they're burning out, right? All types of clinicians. But if you could make them more efficient, that could help with the burnout. Mm-hmm. You could still get the same productivity in terms of numbers of patients seen and those types of things, but you get a better quality out of each of those encounters.
Yeah, I guess, and if you don't keep your eye on the goal.
Exactly. And if you don't know what result you're expecting, you won't know whether you reached it or not, and whether that tool that you just deployed had actual benefit to your organization.
Right.
So that Goldilocks zone of really the smaller things. Don't try to boil the ocean. Don't go for the biggest, most onerous task that you can imagine and try to make that automated with AI, because it's going to be a long process. You're not going to see return for a very long time, if at all. And your organization's going to look at you and say, what are you really doing for us? No organization has that amount of time to see a positive result. So starting small and creating those virtuous cycles of continuous improvement, the same way we do continuous quality improvement throughout hospitals today anyway. doing one project at a time. You gain organizational competence, you gain those capabilities, and you gain a real comfort level while everybody's learning AI together, but they're able to see a positive result quickly, and they can understand, oh, this is why we're doing AI. This is why we're tackling these tasks. And it, like I said, virtuous cycles, they just build on each other.
Yes.
Then you can move to harder and harder things while improving your foundation all along the way.
Yes, makes sense.
Yeah. Kind of wrapping up today, I think there's a little bit of a fear of AI. Maybe it's a healthy fear on a few different levels, but one being kind of the thought that it will replace humans, take jobs away from humans. What are kind of your thoughts on that and recommendations if folks are, if there's concern that it's going to replace, humans?
So that's a fun one that I'm going to flip on its head.
Okay, great.
All right. So in medicine today, we have a massive shortage of specialist physicians. We have a shortage of primary care physicians as well, but that's being augmented fairly successfully with nurse practitioners, PAs, and others that are helping to fill some of those primary care gaps. And telemedicine and other tools are really helping in that arena. Specialty care, though, is a big problem, right? The average person has to wait 2 to 3 months to see a specialist if it's an outpatient setting. On the inpatient setting, thankfully, it's a little better. But there's also good data that those people that have to wait longer actually have worse outcomes. And in many cases, for example, in cardiology, that patient may actually end up going into the hospital with an emergency because they waited too long to get that specialty care. So we have actually empty jobs today where there are no physicians to fill them. There aren't enough to go around. I can only hope that some of those empty jobs will be replaced by AI. I think it might happen if we're very, very lucky. But the reality is we don't have enough training spots in the U.S. to train people.
Right.
We can't train our way out of that problem.
Yeah.
Even if we doubled the number of training spots for all of those specialties, we can't train our way out of that problem.
That's right.
It's a big deal. The other thing, too, is if you can lighten the burden on clinicians, maybe some are willing to practice a little longer before retirement. So that helps with that shortage, which is only getting worse every year. So I would say we hope AI replaces jobs, but at least for clinicians, I think it's going to be the empty jobs we can't fill today.
Right. So selectively.
Yes. I think that's a good way to look at it. I like that.
It may stem the crisis if we're very lucky.
Yes.
Well, we have enjoyed having you on The Pulse today. Thank you for making the time to come and share your insight with us.
Absolutely. It was my pleasure.
6 months from now, we'll have an advanced conversation. It'll change in 6 months. But for those of you who joined us today, I hope you enjoyed speaking with Justin Collier. He is the Chief Technology Officer for Healthcare Innovation in North America for Lenovo. Thank you, sir.
Thank you both.
Thank you.